This is CityCast Madison. I'm Bianca Martin, and here's what Madison's talking about. Today, did you know May is Mental Health Awareness Month? The National Alliance on Mental Illness, or NAMI, takes this month as a chance to stand in community, recognize that no one struggles alone, and destigmatize mental illness and mental health care. Joining me now to talk about navigating mental health journeys and local supports is Jamie Mulry, Executive Director of NAMI Dane County. Jamie, welcome to CityCast Madison.
Good afternoon. Thank you so much for having me.
Yeah, such an important topic. And I feel like maybe we could always say this, but it's like there's never been a better time.
Yes. Mental Health Awareness Month is every month, but we really want to talk about it this month.
Yes. Well, NAMI is the country's largest grassroots mental health organization, and it provides support, education, and advocates for policies to help folks struggling with mental illnesses. But what I didn't know until prepping for this conversation is that NAMI started right here in Dane County. My mind is blown. Can you tell us about how NAMI came to be?
Absolutely. Yeah. It's one of our favorite Madison nuggets to talk about. So it started here in 1977, and it was really simple. It was three frustrated, fierce mama bears that had sons with severe and persistent mental illness, specifically schizophrenia. And at that time, deinstitutionalization had just happened, but there was no social safety nets at all. So individuals were not able to access care. And so these parents wanting to just figure out how to help their adult children got together, decided to support each other, which family support is a big piece of what we do as well, and also ways that they could help support their loved ones. And through that, this organization has grown. So from Dane County, it went to a national conference. They thought maybe like 50 people would show up, and 200 people came from across the country. It turned out that everybody else was having similar experiences. And so from there, the national organization grew, and now there is affiliates in all 50 states and state offices as well. So we are actually the founding chapter. So it's something that we are very proud of.
That is incredible. There's so much pride for that. And I'm trying to think about being back in that historical moment and what that would have felt like. Oh my gosh, a light in the dark. We need something, and we need something now. Give it to mothers to make it happen.
Yeah, absolutely. And actually, one of those fierce mama bears is still here in Madison. She is 91 years young, and she is still very much involved in the organization. And it's just, it's always great to talk with her, and from where we were to where we are now, and then how much further we still have to go. And so it's really something that we're proud of, and something that we take very seriously, and feel this responsibility, right, to carry on that legacy and torch.
Yes, it's something that needs to be taken so seriously. And also, I'm just sharing joy and getting the chance to talk with y'all because of just knowing that you're there means a lot to me. Speaking for my own mental health and my own journeys, but my family, friends, we need community and to be in community for health. And I want to ask about Mental Health Awareness Month and what it means for our local NAMI chapter. Do you promote events or any specific resources this month for folks? What does this month mean for NAMI Dane County?
For us, it's really an opportunity to kind of highlight the things that we do to support our community. So we are having an event at the end of the month where we will actually be highlighting our programs that we do, both from a signature program, like our support groups and our education classes, and then some of the enrichment programs that we've added to our calendar, because we've realized that support groups aren't for everybody, right? So how can we reimagine what support looks like? And so we've added a support kitchen where we have a chef lead cooking lessons, but they also talk about mental health. We have a cookbook club, and we're working with the Curious Crafter on art therapy. So all of these different ways that we can support the community. So it's our time to shine and to really just bring awareness. And to your point about, just knowing that an organization like NAMI is here, and that, that we need to be in community with one another. The tagline for the unofficial tagline for the organization is "You are not alone," right? And it's something that's so simple, but it's something that's also so powerful because I feel like when you think you're the only one, it's very isolating, and that stigma exists, right? Because you feel like it's something that you shouldn't talk about or that's not common. And our job year round is to make sure that people know you're not alone and we're here to help you.
Yeah. And, to one of your earlier points, this is for folks who struggle with mental illness and also for their whole family, the whole support system, and supporting that whole family is a major aspect of what y'all do, which I just really wanted to hone that point in as well. And to pick up on your next point, one of the ways to destigmatize mental illness is talking about how folks aren't alone, just how common mental illness is. Jamie, like on a national scale, how prevalent is mental illness?
It's very common, when we go out and we do awareness events and things like that, the statistic is that 1 in 5 US adults experience a mental illness each year, but the other 4 know somebody who does, right? So it affects everybody. And so, yeah, it's very common. And that's not to say anything about severe and persistent mental illness, which is 1 in 25. So that's schizophrenia, bipolar, schizoaffective disorder. So, it's very common. If you're in a room of 30 people, look around, right? You've got a good chance that you've got people that are living with something that you may not even know about.
And to that point, there's varying degrees that everyone experiences. There's like a spectrum. And also, some people will have mental illness and it goes away. And there's also folks that have quote unquote like lifetime mental illnesses. What do we know about that data?
I think the biggest thing to look at when it comes to that is that half of all lifetime mental illnesses begin by the age of 14. And what that highlights for us is that early intervention is very important. If we can provide those supports early on, then you don't have adults that are, potentially not able to navigate this when they're in the world. So those early interventions are really, really important. And from like a standpoint of recovery and what that looks like for individuals living with a mental illness, the support that people are able to gain give the best outcomes. As I spoke about Nancy, she had an adult child with schizophrenia, and he actually is just turned 70 in December. And what that highlights for us is that with the proper supports for families and individuals, people can have a very significant recovery and live their lives. That's about 16 years older in life expectancy than someone that has schizophrenia statistically. So it's a pretty stark difference of just what a little bit of support and education and whatnot can do.
Yeah. And just reflecting on the fact that you might be navigating this for your entire life. And, 1 in 5 US adults, that sounds like so many. Do you think those numbers even accurately capture the full picture, even with efforts to destigmatize and educate about mental illnesses? I have to imagine that there are many people who are still dealing with undiagnosed mental illnesses every year.
Absolutely. Yeah. I think that a silver lining that came out of COVID is that the conversation around mental illness got more normalized. And that was something that really enhanced awareness. And so I think that people were more willing to be open to those conversations. And, and a good reminder that just because you don't have a diagnosis doesn't mean that you aren't struggling. For our support groups and things like that, we don't require a diagnosis. We just require that you want to be in community with other people that are navigating a similar path as you.
I'm sure you remember. I certainly remember during COVID, it was like a relief, almost like the floodgates. Finally, people are talking about this. Floodgates are open. And a lot of people couldn't access care. There was a shortage of providers. So when we're thinking about delays in getting help, what are the kinds of barriers folks are facing today, 2026, when it comes to accessing mental health care?
Yeah, there are a lot of barriers, which are all things that we try to address, both from like a support, but also an advocacy standpoint, because advocacy is also a big part of what we do as well, with regard to public policy and state, local, federal budgets and things like that, we are at the table for all of those conversations to try to address these systemic issues. Some of the biggest ones being, like you mentioned, the provider shortages and just long wait times. Oftentimes, if you're in crisis, a 3-month waiting list to see somebody is not super helpful, right? It's a good step, but there's supplemental support that you're going to need between when you make that call and when you actually get that care. That's one big thing, probably the biggest thing. The other one is, of course, insurance and financial hurdles. We know that it's, everybody's got copays. Some people don't have insurance at all, and they're just paying out of pocket. So that's always a big barrier. And there's also just the stigma that exists, with vulnerable populations. I just did a presentation recently on men's mental health and how important it is for men to talk about mental health because they're 4 times more likely to die by suicide. And really, a lot of that can just be attributed to the fact that it's sometimes frowned upon to ask for help. And it's not, it's looked at as a weakness, which it absolutely isn't, of course.
It's not quote unquote manly or something.
Yeah. So it's kind of like reframing strength as navigating that path rather than kind of sitting with it by yourself. And then the other thing is just the shortages in specialized care. For example, adolescents that are in immediate crisis. In Dane County specifically, 70% of adolescents looking for mental health care failed to receive it at least once between 2019 and 2022. And so that's telling us that even though people are even taking that step to ask for help, they're hitting a barrier. One thing that did come out of, again, from COVID is the prevalence of telehealth. It wasn't really something that was done widely. And so that transition to telehealth, and also for us to be able to have virtual support groups, right? We couldn't meet in person, but we pivoted and we found a way to continue serving people. And, some of the barriers are transportation. It's as simple as that. Or childcare, and so if you can sign on to a virtual support group or something like that, that's really helpful. Or, that stigma, anonymity. You don't have to turn your camera on, and some people take those baby steps to get comfortable. And just meeting people where they're at every point is what we found the best way to impact people the most.
Yeah, it's interesting, mentioning specialized care. Something that came up for me is thinking of someone who's dear to me, who's transgender, has felt like I don't want to go to a therapist or a provider that isn't trained in my life experience because I don't want to become further traumatized. And it's like you said, someone wanting to reach out, ready to ask for help, but is there the specialized care?
Yeah, that affirming care is so important. The Trevor Project has been a pioneer in working with local communities in assessing what's available, and organizations like ours, people call us looking for help, and we have, lists that we have of friendly organizations that we know will suit those needs. Because yes, we don't want to further traumatize people and bring them to a place where they don't ever come back again, right? That's the worst thing that could happen is they make that big leap and then they're discouraged from continuing to get help. And so that specialized care is so important because it's not a blanket, response. And so we're hopeful that those resources will continue to grow.
And you mentioned the work combating stigma. I'm curious, are there racial disparities that we continue to see in access to mental health care and folks feeling comfortable reaching out?
Yeah, there's that social and cultural stigma that exists, specifically in BIPOC communities, just not seeking professional help. And that comes, at a rate of 25% of Black Americans seek mental health care compared to 40% of white Americans. And, I would say there's a lot of historical mistrust there. And I would also say that, cultural expectations. And then back to your point about affirming care, going to a therapist that looks like you, has navigated similar paths as you is very important. Lived experience is one of the biggest things that we talk about. And so having someone that's able to speak with you on that level and again meet you where you're at is very, very important. So continuing to see organizations like Anesis who provide that, that care where they're able to provide that specialized care is really important.
Yeah, shout out Myra Renee, who's been on the podcast.
Yes.
Let's get real local and talk about like the state of mental health care needs in our community. What do we know about the needs here in Dane County?
One of the biggest things that we look at is the rising youth demand. We haven't talked a whole lot about youth mental health. And so just to share a little bit about that, obviously we're a college town. So right off the bat, UW-Madison consistently sees a multi-year upward trend in students seeking mental health services. And, I don't think that's necessarily a testament to there being more, individuals that have mental illness. I think it's more individuals that are willing to take that step and to identify those needs that they have for themselves. I'm 42 years old and I'm an elder millennial. And even, I was not diagnosed with anxiety until I was about 25. And I probably should have been diagnosed when I was like 12, right? So, just like the Gen Z college students, it's in their vernacular. They're comfortable talking about it. And I think they encourage other people by just kind of being open about it. And so I think that's, we're seeing that trend. And I'm glad that hopefully, the university has a lot of resources that are available, which is great. And then the other thing, of course, is school age, middle school, high school students. There is a high prevalence of anxiety and depression, 36% experiencing anxiety and 33% experiencing depression, right? And so when we think of those statistics, that's pretty significant. And, we do a lot with suicide awareness and prevention. And we go into the schools and we do this education. We have a program called Mental Health Chat that starts in 4th grade. That's when these conversations start, when you're giving kids the language to identify how they feel and you're normalizing it for them. So they're able to ask for help when they need it and they know that it's normal. We are currently doing a pilot program with Monona Grove School District called the Parent Navigator Program with our parent peer support specialist. And so student services staff will make a referral to us for parents that need help navigating this road. And our parent peer support specialist will meet with them, help them navigate, and also provide support for the parent. Because again, you're on an airplane, they tell you to put on your oxygen mask before you put on somebody else's. And we kind of feel like that very much applies to the work that we do with everybody, but specifically with youth, because I think oftentimes parents are, trying to be everything and all things. And oftentimes we're struggling ourselves as well.
Gosh, this is such a rich topic to dive into. My brain is on fire with different things to respond to this. Thinking about the important work generationally. We started the conversation saying NAMI started in 1977, and there was this space where parents were trying to be of help and support to their kids that were struggling with mental illness. And, I think of videos that I see or comedians making jokes about parents basically saying things more or less like, you don't have depression. Like, I'll just, being dismissive of youth, trying to let them know, hey, actually, I'm struggling here. Maybe I saw a video online. I'm connecting with this. And I think, some former generations, I'm a millennial, so it's easy for me to say in some ways, former generations that were just told to push through or maybe didn't have the language to identify what was going on with them. And it never came. The cavalry never came, but now it's here more and people are making this active effort and have been for decades. Do you have any, the latest thinking on that and that relationship between parents and kids' mental health and those continuing dialogues, almost like a mutually beneficial space for intergenerational conversations on mental health?
Yeah, absolutely. I think it kind of goes both ways, right? I think how they got recycling to go, very popular was kids coming home from school and telling their parents about what they were learning about in school, right? That's how it got to that point, right? And so I think it goes both ways. I think that, kids having the language and speaking about those things can help parents be more comfortable and really maybe look a little bit at themselves, right? And say, hey, maybe this is something that I should address. And then from, an affirming standpoint, obviously having parents and adults in your life that are just affirming where you're at and telling you, it's okay, I'm here to help you, I'm a resource. One thing that's a statistic that really sticks with me is that for LGBTQ plus youth, having just one One, affirming adults in their life reduces their likelihood to die by suicide by 40%. And that's powerful, right? Like that's like you could be that adult, you could be that person, and parents, teachers, obviously, just having those people provide that support, it goes a really, really long way. If they know they can talk about it, they will.
Mental health is so critical for all ages, right? And I do want to ask, for the folks who are listening right now, maybe someone listening is struggling with their mental health. What is a good first step for them? And what kinds of things are available in our area for Madisonians to get help with their mental illnesses?
Thankfully, we have a lot of resources here in Madison and at the county level as well. A great first step is telling somebody else, right? Bring somebody into that circle with you. And so that right off the bat, you know that you're not alone. Organizations like NAMI, we take phone calls all the time, resource phone calls. All of our staff are trained to do those resource phone calls where people are looking for help and they're looking to get connected. And so we oftentimes are the connector to lots of other things. If it's a youth, working with social workers at the school to be able to connect with other organizations in the community that are doing great work around mental health. There's Briar Patch, who does great work for youth, and so many others, of course. And then just in general, I talked about Anesis earlier. We are big fans of Anesis. We refer a lot of people over that way. Access community health centers. It's important to point out that there are low cost or no cost options available. So not letting that financial part be a barrier, right? And so we're very fortunate to have that. And then, the county has some programs that are available through the Dane County Department of Human Services. So there is ways to tap into programs like CCS, which is the Comprehensive Community Services, where you connect with someone who helps you navigate all of those things. They help you make that call, right? To have that appointment. That phone anxiety is real, and even just making that call can be a big deal. And so having somebody just right beside you that's able to do that is huge, right? So that's easy to say, oh, just reach out to people. So again, having organizations that are available with peer support. Peer support is a big piece of what we do as well. That's a one-on-one with someone who is certified by the state of Wisconsin. It's not a therapist. It's not a psychologist. It is a gentle listening ear from somebody who has lived experience that they can share with you, which is also really important. You go to a therapist, they can't really be like, yes, like I can talk all about myself too. I mean, some can.
They do a little bit sometime, but
yeah,
they try not to.
Yeah, exactly. But peer support, that's the super strength, right? Is the ability to relate in that way. And so getting some of that one-on-one with somebody and really just sitting down and getting those things ready to go. And then from the standpoint of families, I think one thing that I've learned from talking to a lot of individuals who at one point were resistant to care and things like that is the one thing that they said that always sticks with me is that my family did a bunch of work on the front end. And when I was ready, they were ready. A good portion of the phone calls that we receive are from parents of adult children with mental illness. And so a big piece of what we do is working with them to go through, these are all the resources, these are the places you can go, this is who you call for crisis. And, that preparation is huge. It's a whole family, whole community type thing. And then, of course, we're so lucky to have Journey Mental Health in our community, who provides so many resources, namely being a part of the CARES team here in Madison, which is the Community Alternative Response Emergency Services. It's people responding to mental health crises where we say, you know what, law enforcement isn't maybe necessarily the best option here because we have someone who can respond to this mental health crisis the way that we'd want to, which is somebody who can provide resources and de-escalate. And so Journey Mental Health Crisis Workers, along with Madison Fire Department, community paramedics, go to mental health crisis calls and they provide that service to them. And, so we have, again, these resources, even in crisis, we're in a community that's making strides to give people better outcomes, to love people better, right? And to build those bridges to empathy and compassion and understanding.
And it is so central to what folks need is the care, the empathy, the compassion. And we've been talking a bit about destigmatization. And I think one of the biggest things that I see, because I try and be as up to date with mental health and try and heal myself and be in community with others who, struggle through mental illnesses. And sometimes people will be struggling. You're talking about families that reach out and they are doing the first steps. They're setting things up because sometimes an individual, like, they're down bad. Like, and not saying that in a moralistic way, it's like, I can't get out of bed. I can't clean these dishes. The idea of being able to navigate these systems without support is just unrealistic. It's frankly impossible. And there can be people who are less familiar that add to the stigma that will see someone who's struggling and be like, why are they lazy? Why can't they just get with it? Life is hard. Life's hard for me. And I've had these conversations with many people where it's just like, and there's a thing called brain chemistry. And there are truly things that you don't understand. And yeah, I guess I'm bringing this up to, dig into the destigmatization conversation because I think a lot of people are often worried if they get a diagnosis, it means that something is wrong with them. And that's really dangerous.
Yeah. There's someone that we work with on our advocacy committee that is currently in a profession where they will lose their job if they have a mental health diagnosis. And there's instances of that where it could be detrimental in that way. And people that see a diagnosis as a moral failing of some sort, right? Or a parent who sees a diagnosis of their child as a moral failure on their part, right? And so I think that there's a lot of ways to address the stigma. And again, it comes from having open conversations and it comes from awareness and the work that organizations like ours, organizations that go out and talk about it and start the conversation. I've presented anywhere from fourth graders to octogenarians, that like really had never had that conversation before. But you know what? They had some of the best questions because someone had opened that door for them. And so I think, we say it a lot, but meeting people where they're at is so, so important. And, as that stigma hopefully keeps peeling away, that central message of you are not alone comes through. It's okay to not be okay. Self-care is mental health care. All of these things that are, the taglines, the cute Instagram like graphics, but they're there for a reason because they're true. And they're things that are very simple, but also address a very complex problem.
Yeah, and we don't want to be discouraging anyone from reaching out. And I know in my own life experience and have had family members that had some kind of feeling about medicine, and I'm not a doctor. And when I needed medicine for mental illness, it really changed the game for me. And it's the idea that people step in the way of people getting healthy. And I think they're doing it inadvertently. So these conversations and being open and not shutting things down for people, because it's like, you don't know what they need. You might know what you need, but you don't know what they need. And I also want to throw out there the fact that I know many people who have gotten a diagnosis. And then funny enough, once they came to accept it and realize, oh, that's me, it was relief to have an understanding of why this is happening versus staying in the dark on what's, not working for them.
Yeah, absolutely. I think, even just speaking for myself, once I started taking medication to address my anxiety, I was like, oh my gosh, not everybody, this isn't how people I don't have to live like this, I just thought it was normal, for a lot of people that have, not addressed it or not spoken about it with other people, it's their baseline, And so I think for a lot of people, the relief that comes with medication, if that's the journey that they go on, it's a relief. And it's affirming because you're like, you know what? I knew that there was something that I needed to address. Yeah, that relief is it's huge. And being able to get to a place where if you choose to take medication, you can, if you're comfortable being open about it, I share a lot with everybody. Of course, I'm in mental health circles a lot, but with my family and with people that maybe are not in environments that are as open. I very openly share about my journey, and again, highlight that relief that came with it. Because once you kind of get over that hump, you're like, okay, this is good. I can get used to this.
Totally. And it does take courage. Like, it took courage for me to just share that on the podcast. But I'm like, this is the point. Like, it's the space to be destigmatizing these things and to not stand in the way of getting the help you need and other folks getting the help that they need. Jamie, this has been such a good conversation, really fruitful. And before I let you go, what's one step we can all take for our mental health this May?
I think that it seems very simple to say, but I think the best things that we can do is we can love ourselves and we can love others. And when we do that, we will take care of ourselves and take care of others. It's a testament to all of the things that we try to bring together here as an organization. And, we're happy to be able to bring those things to the forefront and just, again, remind people you're never alone.
Jamie, thank you so much for coming on CityCast Madison. It means the most.
Thank you so much.
That's Jamie Mulry, Executive Director of NAMI Dane County. That's all for today here on CityCast Madison. I'm your host, Bianca Martin. Don't forget, you can support the show and get great perks by becoming a CityCast Madison neighbor at membership.citycast.fm/Madison. And if you enjoyed today's show, why not share this episode with someone who might be interested in being in community around navigating their mental health journey. All right, y'all, we'll be back tomorrow morning with more stories from around the city. Until then, take good care and thanks for listening.